Welcome to the CMO Spotlight today. And today I'd like to welcome Julie Washington, who is the Chief Marketing and Communications Officer and the Chief Customer Experience Officer for Trinity Health. Welcome, Julie.
Thank you. It's good to be with you.
Thank you so much. So I wondered if you could start by just telling us a little bit about Trinity Health and a little bit about your role, what you do there.
Sure. So Trinity Health is one of the largest Catholic health systems in the US. We are in 25 states. We're about 20 billion in revenue, and we have a little less than 90 hospitals. We also have about 25 PACE centers and over 130 continuing care locations, over 100 urgent care locations. And so think about us as the fullness of care, not just acute care in a hospital, but what happens when you want to live healthy and long, and who can take care of the variations of needs. And so we have about 115,000 colleagues, which we call each other versus employees. So there are 115,000 colleagues. And we have both employed physicians, about 7,000, and then we have affiliated physicians, about 25,000. So a large swath of connectivity and relationships in order to ensure that we're caring for our communities. So the second part of your question, what's the role? So when I was hired in the first part, which was marketing and communication. So I came in, and the key idea was, how do you think about building the brands and making sure that we have a position and clarity around who we are, how we serve in the communities in which we operate. About 11 months into the job, there was a movement in leadership, and I had experience around retail customer service. And so I'm very much commercial oriented. And so I think between that and also talking about the brand and doing strategy work, made me a likely candidate to take on then the customer experience. So more than just patient experience and how your ED appointment went, or something in the hospital, but how do we think about holistically your consumer or customer journey, and who's going to be in charge of understanding and connecting in a way to help solve for the problems, but also ensure a more delightful experience.
Wow. Well, and you mentioned having a CPG and consumer experience before we even started recording this. So I'm curious about your career path. It sounds like an interesting path that led you into healthcare a little later in your career.
Yeah, so I'm not doing what I said I'd grow up and do. So for the fullness of my time, from second grade all the way to college at Emory, I said I was going to be a pediatrician. So I was heading to medical school. I did complete the degree to be a chemistry major, but elected not to do medicine. But life has brought me full circle back around. But you say, well, then how do you land in marketing after being such a STEM student and focus on the sciences? And, but I also had a degree in psychology. So maybe I was my own best patient to try to figure out why was I doing what I was doing. But it was the opportunity to think about how to serve in a more connected way, right? So if it's not going to be through medicine, there has to be another way. And I did a lot of state orations. So I enjoy telling stories. And then I found this small little group called marketing while I was in my MBA program, and fell in love with how we communicate what's in our hearts and what's in our heads. And so that sort of brought me to the doorstep of marketing. And boy, am I glad. It's been a wonderful career path, with a lot of sort of twists, turns, opportunities, learnings along the way that bring me today to Trinity to hopefully bring the bearing of that insight in history so that we're better in the service that we provide in healthcare.
Yeah, and we'll get into a little more detail about, obviously it's been a very interesting time in healthcare with COVID-19 and global pandemic and dealing with all of that. But I'm curious if there's a specific piece of advice that you wish that you'd gotten earlier in your career, or maybe a piece of advice you would give to somebody who's pretty young in their career.
So I'd probably think about the young Julie and say, okay, where did we not get the intelligence that you wish somebody would have imparted? And maybe it's around having what I'm going to phrase as your own personal board of directors. So I was very clear about my gifts, my talents, and you're trying to hone them and you're trying to be the best that you can be in everything. So I won't say I was an independent agent, but I hadn't thought about myself in a business mindset. But if I had a board of directors, there would have been a few other people that could have guided me, maybe corrected me sooner, accelerated me toward opportunities that I probably missed because I just didn't have it in my line of sight. But there's a proverb that says, if you want to go fast, go alone. And if you want to go far, go together. And so I have 3 children. And if it takes a village to raise my three children, I can only imagine how many people it takes to raise an adult. And so I, in the corporate arena, where someone could help me see the importance of that sort of village, of that board of people from different perspectives, helping you be the best as you pursue your purpose.
So that leads me to a question about that. How do you find your board? How do you, where did you collect these various people that you coalesced around Julie's career path and helping her make decisions along the way?
You know what? They're all around you. You just didn't see them for who they actually were. So for instance, when I moved to Cincinnati and P&G had purchased Gillette, I met this gentleman. I was in a program with the Cincinnati Chamber, and they were helping new leaders get oriented to the city and ensure that we could connect beyond just our jobs. And so my husband and I were a part of this Introducing Cincinnati group. And this unassuming man, we were at the Underground Railroad Freedom Center. He was doing a session and we came up afterwards. I danced in the ballet company. I love music. So he was on the chamber orchestra. So we're just chatting along the way. And unbeknownst, by the end of the evening, I was walking away saying, I think I just committed to this man that I'm going to be on the chamber orchestra board. It was the best sort of accidental moment of commitment that I could have ever had, because here I stand 20 years or so later with him meeting me every quarter, imparting wisdom and insights, not just about Cincinnati, but he was the leader of the United Way. So I also have United Way insights of nonprofits, but the community and the people and just his perspective. He was there, but I could have missed him if I didn't engage in what we had in common and where we might be able to connect. And so he's just one example, but there are people in your family, there are people in your friendship network or collegiate alumni association. And then there are those right here inside of our organizations that want you to be successful. And if you're willing to learn and to grow, there are people that will share without any hesitation, and they will give freely to you.
Yep. Well, I tell young, students just out of college or whatever, that the 2 things you want to accumulate throughout your career are relationships and skills, skills and relationships, experience and relationships. And I think you're pointing out a really important point, which is that those relationships come throughout your life, and that, you want to nurture them because they will pay off dividends down the road when you least expect it.
That's exactly right. If I can build for a second, many times you take just what is offered and you don't expand on what the possibility set. So remember, over the years, maybe the decades, many of the conversations were around mentoring, right? Do you have a mentor? But what no one shared, or maybe I just didn't ask to pursue further, is who else should be in that sort of close circle of yours. Mentors are great. They can tell you what they've done. You can learn from them. But where my career truly changed was having a sponsor. When someone puts their name behind you, when they open the door or they pull a seat up and says, you're sitting next to me, and they're going to walk life's journey with you because they see potential that maybe sometimes you don't, it's totally different than a mentor. And they go in rooms that you will not have the knowledge or the access to, but they take you in your brand with them. And so I didn't get the sponsorship piece as early in my career as I probably could have, should have, or maybe I would have hoped for, but it's never too late. And so great sponsors, and there are those that are still with me sponsoring in many different endeavors and pursuits that I had.
I love that. And I'm imagining that you've probably also been that sponsor for others along the way too.
I do my best to pay it forward. I'm a part of an organization, Becca, our Black Executive CMO Council that we formed last year. And within Becca, a core tenet, in addition to what pours into us, is that we've launched our playbook. And part of that is about reaching back to bring the others forward, right? So what is the legacy going to be? Is it just what advertisement or award did we do, but how do you impact lives? Not just in the services or the products that your company sort of produces and offers, but what do we do for society and for people? And so, yes, I'm hoping that I'm that mentor. I make space and time to sponsor and say for people what maybe no one else has said for them. But the third part of that is coaching. And so I am an International Coach Federation coach. And it was really about me trying to understand me. And it's a key tenet of how you show up as a leader is learning how to coach people toward where they're trying to go, not so much where you're trying to direct them, but helping people live their fullness of their life and not the one that you want. But coaching is a different muscle that I think I use versus sponsorship. But the three together can make a world of difference in your life and in your career.
I love that. All right. So that leads me right into a question that is, I believe that everybody has a superpower, and I'm curious what you feel, or maybe that you've been told your superpower is.
Well, I don't know if anyone's nailed it down to say this is the superpower, but let me see if I can put a framing around what my point of difference and what my go-to is. It probably would be the word of determination. So I sort of show up in every situation, whether at home or here at work, around believing that I can. Now, it doesn't always mean that I'm equipped to do it in the moment that I say that I can, but the point becomes that I believe that as long as they say the fat lady hasn't sung, I have a chance. I know the odds are against me in some instances, but I at least still have the possibility. There's a friend of mine in Texas, and she used to say, Julie, you have to see it before you see it. So I've worked a lot around my visioning of what I believe is possible. So can my team, even if I'm outnumbered or outspent by the competition, that doesn't mean I still can't win. It's that David and Goliath kind of concept that my superpower is that if I say it, you can basically take it to the bank. I'm going to find a way to get it done. And there are resources and creativity that usually is at my disposal that'll help me figure my way forward. But in the moment, I won't always say I have a plan, but I am determined to show up when I said I was going to show up.
So I think you have something in common with the Zennials, or the Zoomers, as some call them, which is the idea of manifestation. You know, it's like manifesting it into existence is a great way to, you know, think about something that you would like or that you envision. There's a lot to be said for visualization of things before they happen.
Yeah, you know, the power of the mind. It is a control tower. It determines how your day goes. You decide if you're seeing that it's bad just because the sun's not out or whatever it is. And so something my children do is we start every morning with an affirmation. I believe there's power in your word. So you need to speak over your own life, what you want to manifest, right? So can you see you passing the test? Can you see you getting promoted? Now there's some work that needs to happen, but can you even envision that it's possible? You know, I have to believe that Olympians have to see themselves winning and breaking records and running faster or swimming farther. At the end of the day, you have to be able to see that which doesn't exist today in order to get to the next level. It may not be that, you know, in the end state, but at least you're closer to it than you were before you said, I can't do it. And so I'm believing in the I can of Julie more so than probably all the factors that would say, you probably can't do that. But I was like, okay, well, we'll see. Yeah,
well, it's fun to push yourself with a challenge that's a little bit out of reach, you know, and then reach for it and achieve it. So I'm curious where you find inspiration either for yourself or for your marketing team, you know, at the health system.
You know what, we were just in a leadership meeting today of the executive team, and we talked about what inspires our collective 115 or so thousand colleagues. And I'd say the majority of people talk about our mission. So my team is, you know, we're the storytellers. We're there to amplify who we are and why we show up in your communities. And I believe it's totally connected to our mission, which is basically to serve together. So there is a unification that's needed. You can't do it by yourself, but we're basically serving to be a compassionate, but also a healing presence in our communities. So we know that the order of the work is of a higher level. This isn't just about whether you buy the whatever product or the services. This is life-giving, it's life-sustaining.
Mhm.
So if you do the mission right in a loving and caring way, not just in a tactical way, you can find worth every day. That I gotta believe through COVID, many people were happy that there was that nurse or even that doctor that showed up to serve together so that you or your family member would know how to stay connected in a bad situation, but also how to ensure that you come out on the other side.
Mhm. So other than the elephant in the room of the massive global pandemic that we've been dealing with, what's the biggest challenge that you're facing as a marketer specifically in today's environment?
Yeah, the biggest, I don't know, maybe there are several competing
Yeah, right.
for what's the biggest. In the pure marketing sense of the word, I'd probably say that I've been in healthcare for 2 years. So as I look at it, it's finding the point of difference and a way to articulate who we are as Trinity Health. So there are many other health systems, other Catholic health systems. If, I always say, if you turn the sound down and you didn't see the logos, could you tell me who that brand is? What is it that's different? And that's where the patient experience and overall customer experience shows up. How is it that when you encounter us anywhere along the journey, whether it's making an appointment, actually seeing a physician, having a surgery, paying for the services, getting your information out of your My Chart, how do we show up differently in a way that you say they get it? They are truly, which our vision is to be the most trusted healthcare partner. How is it that I really do trust Trinity Health, whoever that is today and whatever name? And it's hard because it looks like a sea of sameness at times. Right? If you're in a market where there are a lot of hospitals or physicians, you don't always know one from the other. And you're like, am I with that one or this one? And so that's the piece that we're trying to do, is tease out, not in just marketing the message, but clarity on the strategy and understanding who we are. So now we can do the creativity of how do I express what is the experience of Trinity that's not what you would find in another health system. So that's the task at hand for the Marcom team.
Wow. So setup exists to connect brands and agencies. That's often, we live in the space between brands and marketing agencies. So we're not a brand, we're not a marketing agency, but we really think a lot about that relationship. And so I'm just curious, generally, either at Trinity or even in a previous life, how do you work with marketing agencies?
Yeah, so I would say it's no different here than in any of the other organizations I've been part of. Literally, I always believe agencies or even vendors, they are truly partners. This isn't a contract for a number of hours and whatever is in the scope of work, but it is really a part of having a seat at the table. And what I mean by that is ensuring that they're there for the marketing planning and strategy meeting. When we're talking about the monthly business results, how am I making sure they understand what we did and didn't get done in this last report, right? They can look at the dashboards to understand what we might need to shift, what I might be asking of them. I'm expecting them to bring solutions as much as our colleagues are. I treat them the same. I give them mid-year reviews as well as annual reviews. The only way we're going to be better together is if I share with you what's working and you share with me what's working, and of course, when it's not working. But we shouldn't wait to a culmination or for me to read your mind. So they are an integral part of how we do what we do. And I expect them to talk in the we, us, and our, not the you and yours, because the brand belongs to them. The experience is theirs. And so hopefully any agency partner that I've been a part of and have hired, that they actually could say, yes, Julie is serious about making sure that you're there. But there is also an accountability with that, right? So you don't just get to sit at the table without having voice and without having a responsibility when you leave the table.
I'm curious if there are certain marketing functions or disciplines that you feel we should almost never outsource that outside of our organization, or are there certain marketing functions or disciplines where you feel we should always get that external perspective or expertise? I'm curious how.
Yeah, so I would not put my brand strategy, brand planning in the hands of someone else. That's our responsibility as the brand stewards and the leaders for the organization. So there are inputs, right, even inside the organization as well as agencies, but that's not something I would hire someone else to do. They can guide us, but that's, in my mind, our responsibility. I've had in-house agencies as well as external agencies. So I believe there is room for several different designers and creators to help us tell the story. So I don't try to tell them, I give them the creative brief, but after that, they work their magic. So I believe that's in their domain. In every company, media buying has been outside. So we haven't tried to build that capability inside of the organizations. You know that there are better ways and more efficient ways to bundle the buy, and they can do it on a much bigger scale than what we could do if we did it inside. And so there's expertise there. Those are probably the ones that come immediately to mind. But I think if we are the stewards, we need to own the things that's at the core, and all of those things that sort of expand and extend are the ways you can invite others to help you build on the sort of the concept of the foundation of what we're supposed to do as the storytellers or the demand generators or traffic generators or whatever it is that's your respective category.
Yep. So as marketers, we often interact with folks that are not marketers by trade, that don't necessarily fully always understand the value of marketing. So how do you demonstrate marketing's value so that it's not just a cost center, but a value driver to those in the organization that are not marketers?
Well, I'd say that's part of the teaching moment here at Trinity Health, because much of where we started was around communications, right? So I'd say start at our strength place, and that's been communications. So we haven't let this crisis go to waste. We have been at the forefront every day to talk about what's coming, both to let our colleagues inside know, to answer the questions, especially in 2020, of what is this thing called COVID and what do I do about it, right? So we've added value by showing up and messaging and creating the stories and making sure we were listening, but also reporting. So that was, I'll call it a given, but we were good crisis managers, but then we were also very good communicators. And so from there, we now have extended sort of to the marketing side of how then do we talk about connecting CRM and building out relationships and segmentations and knowing that everybody isn't the same, and how do we generate new customers to our physicians' offices, but extend the referral so that they stay in more of a closed loop system versus they have one doctor inside of our system and another specialist, say, in another system, but it is truly a continuum of care. And so every finance leader is going to want you to prove an ROI, right? So you have to make sure that you understand your financials of how we make money, and ultimately how you spend and what you are going to get in return. Everything isn't going to always be the same, but I think we set expectations, we've established plans, metrics, and ultimately the scorecard is the best way to prove to people why you're worth what you said, and why even more is because investing here allows us for brand reputation or brand building that's more than just another dollar in the till, but people now see me, know me, and use me in ways that they hadn't done before.
So is there a campaign or program, either at Trinity or in a previous life, that taught you a really valuable lesson because it was a huge failure and you learned something you needed to learn, or it was a huge success that you, if you could bottle it and duplicate it every time, you would do?
Oh, I don't know. There are a lot of those that probably fit in both sides of the camp. Probably one that comes to mind, probably more so than others, is because they were personal growth in addition to business impact. And so after 12 years of where I started after the MBA, I actually went to Boston and went to work for the Gillette company. And so it was less than a month on the job. So I still don't know a lot of people. I'm trying to figure out what this new job is. and they invite me in, and I'm in with the CEO, and Jim Kiltz came from Kraft Nabisco, right? So he's like, I'm used to something bigger and I'm not seeing it there. And he says, I want a bigger promotion and it's got to connect. And Gillette had 4 different business units. So they were working as independent entities. They were not working as a collective system. So teachable moment, new girl gets the job to now bring a big idea to the new big boss. And I need to do it with people that I have no control over. Right. I'm going to have the best influencing skills, and I'm the stranger in the room, right? And so what do we come up with? NASCAR. Now, my mother is probably the biggest fan of sports, and she's always watching ESPN, but we didn't watch NASCAR, right? So I'm like, wow, this is something that even I don't even know what this sport is about. So fish out of water. How do you learn and grow while leading on something you don't have familiarity with? And by the way, the clock was ticking. We needed to get this done in 60 days.
Wow.
Oh, by the way, we also need to make money. This isn't just to go come up with this big idea. You better figure it out. So that was building new relationships. So I found lessons around the importance of vision and objective. So what are we trying to do? And so you couldn't do it for all 4 businesses at the same time. So I did it in a phased approach, and Blade and Razors was the heart of Gillette. So we started with that group and we went to Walmart, the biggest retailer. And so if Walmart, Blade and Razors can work, then I can figure out these Gillette Young Guns. And oh, by the way, that was a whole nother negotiation to find 6 drivers and to have all those contracts need to be negotiated. So I learned a lot about building rapport internally, externally, the importance of setting a vision and setting expectations in order for the organization then to give money. And I'm still a loyal NASCAR fan. And if anybody is a NASCAR lover, then the old 48 car, Jimmy Johnson, who's now on the Indy car series. But yeah, so we didn't know anything about it, and now we're diehard fans.
Hey, you know, I grew up in North Carolina, and it's fascinating to see that all of these NASCAR families that are famous NASCAR families were moonshiners. Yes. They souped up their cars to run away from the police, and they started racing them, and they became NASCAR families. So it's fascinating.
Exactly. Always the story is creative, and the seed, you're like, really, that's how it started? So yeah, so everything in life really is a journey.
Absolutely. All right, I have some fun questions for you to wrap up that have nothing to do with marketing. Sure. The first, you shared a quote that I love, but I'm wondering if there's a book or a movie or a band or a sports team that inspires you, and why?
No one entity, I'll call it, inspires, because I'm that determined person. I'm always looking for sort of what's that North Star and what can get me up in the morning when I'm tired and when I'm feeling maybe a little bit beaten, what's going to get the energy level at a higher place. And early when I was young, we used to do a lot of different poems or speeches, and my mom would have us reciting all kinds of things at church as well as in the neighborhood. And so there is a poem that's called Don't Quit. And the first stanza and the last stanza are probably the 2 parts that have made the difference in my life when it gets tough. I used to always have it sort of taped on the walls or on my computer screen, because it reminded me of what it is. And so the first part of the poem says, you know, when things go wrong, as they sometimes will, the road you're trudging seems all uphill. When the funds are low and the debts are high, when you want to smile but you have to sigh, when care is pressing you down a bit, rest as if you must, but don't you quit. And then the last part, after if that wasn't enough, it goes on, it talks about the definition of success, and that was like a big thing back in the 80s and 90s. What does success look like? But the poet says that success is failure turned inside out. So when it says it's okay to fail, because you can turn it around to actually be successful. But it goes on to talk about you can never tell how close you are, because it may be near when it seems so far. So guess what? You have to stick to the fight when your hardest hit. It's when things seem worse that you must not quit. And so usually when I'm having one of those things seem worse moment, I buckle down and I say, that's the relationship I need to lean into, because it's here that probably the good is actually going to be found.
Yeah. Well, as a parent, I had a conversation even last night with my wife about our kids, and what I was saying was we need to allow our kids to skin their knees
Yes.
so that they can learn and grow. If we just make it always easy for them, then they will never really grow. And I appreciate that quote really says, I love the idea of turning failure inside out. That's a great concept. Okay, so I'm curious where you find joy outside of work, but outside of your family specifically. I mean, you mentioned belly dancing, so I don't know if that's it or something else.
Yeah, I wish so. No, that wasn't me, but maybe I'll add it to the to-do list. Maybe two different pieces to your question. My mother was the secretary at the church, and she used to always end her Sunday announcements about departing to serve. So there's a lot in me that loves serving others. My mother constantly does it. I mean, she's in her 80s, and yet she'll talk about taking food to the elderly people. And I'm like, okay, well, who would be elderly if you're in your 80s, right? In her mind, she's not in that group. But the service of how do you volunteer? When President Obama had a large commitment around volunteering, our family dedicated several hundred hours to the community that we were living in Ohio. And the two boys are actually Eagle Scouts. So I'm filled by me serving, but that the family serves together. It's not about us, it's about the people that we get connected to that we wouldn't cross paths with, but it's not beneath us to sit next to them at Thanksgiving, to have a meal and break bread and understand that we're really more connected and the same than anybody probably really recognizes or acknowledges. So making that difference through service. But the second part is I love my sister friends. There is nothing like a good girlfriend gathering, whether it's a small group of us or others, but it fills me up when we get to just have sister conversation. I only have one sister, and I have a lot of cousins and a lot of girl cousins. So I know from the fountain of love that the sisterhood flows. And so that gives me that extra, you can do this tomorrow or the next month or the next year in ways that it's hard to describe if you haven't experienced that fellowship that a sisterhood can bring.
I love that. That's great. Well, all right. So Julie Washington, has been an amazing pleasure to speak with you today for the CMO Spotlight. So Julie is the Chief Marketing and Communications Officer and Chief Customer Experience Officer for Trinity Health. I got through your title smooth as can be this time, but Julie, I've so appreciated this time together. Thank you so much for joining us.
Thank you for the invitation. Have a good rest of the day.
You too.